Good afternoon, everyone. Thank you all for joining. I'd like to turn things over to Governor Mills to start us off this afternoon.
Thank you, Dr. Shah. And before I ask Dr. Shah to give his daily or semi-daily update, I want to speak briefly about where we are 8 months into our fight against the COVID-19 pandemic. On March 12th, Maine reported its first positive presumptive case of COVID-19. March 12th, seems like yesterday. As of today, November 18th, 9,519 people in Maine have contracted COVID-19. 600 people have been hospitalized because of COVID-19, and 170 Maine people have died with COVID-19. Last month, it seems like just yesterday, we had an average of about 20 new daily cases, 7 people in the hospital, and a positivity rate, 7-day positivity rate about 0.58, sometimes even lower. Today, we've recorded 156 new cases, daily cases, 85 people in the hospital, up from 7, and a 7-day positivity rate now of 2.66%. You know, the winter surge that we were warned about, it's not just coming, it's here. And it's expanding, it's growing by the day. Back in March, we knew very little about the virus, but public health experts warned us that we had to flatten the curve, the rate of new infections, to prevent our hospitals from being overloaded and overwhelmed and unable to treat patients of any sort for any reason. Along with almost every other governor in the country, I made the difficult decisions to order Maine people to stay at home as much as possible, to close non-essential businesses, to recommend schools end in-person instruction. That was last spring. Those decisions were absolutely the last thing that I wanted to do as governor of the state of Maine. Would you want to tell people that they can't mourn the loss of a loved one at a funeral, can't celebrate a graduation from high school, can't gather with friends and family to mark some other important event? I didn't want to either, but it was necessary at the time. And it worked. Things are different now, both for better and for worse. We've developed a better understanding of the virus. We've developed new treatments to prevent its intense effects. Not widely used yet, but they're getting there. We've worked hard with our hospitals, healthcare systems, municipalities to expand our surge capacity and stockpile personal protective equipment, which we fondly come to know as PPE. We've put in place safeguards to reopen our schools and businesses, and with promising news almost daily on the COVID-19 vaccines, we're preparing for the distribution of vaccines in stages over time as they are approved, manufactured, and then distributed. At the same time, badly needed financial support is dwindling from the federal government. Unemployment benefits are expiring, and Congress and the president have been nothing short of negligent by not passing another aid package. All of that comes as we've entered the cold weather months, when people are more likely to gather indoors, get together with friends and family in settings that we once thought of as safe, but now nationally, we know that's not the case. So after months of maintaining one of the lowest COVID-19 transmission rates in the country, Maine, like every other state in the nation, has seen a marked increase in cases, in hospitalizations, and positivity rates over the last month. For example, yesterday we recorded 246 new cases of COVID-19 in 24 hours. That is to say, every 6 minutes, another person was diagnosed with COVID-19. Every 6 minutes in the state of Maine, new diagnosis of COVID-19. Community transmission is occurring in every part of the state, every county, every region, increasing the risk of even the smallest gatherings of any sort, indoors especially. And like many people in our state, I'm deeply concerned about this alarming increase, especially as we head into the holiday season. We know what we must do to stop the spread. We know the 3 W's: wearing a face covering indoors and outdoors, washing our hands frequently, watching our distance, staying 6 feet apart. These are all proven ways to lower the risk of COVID-19. I was reading the paper this morning. West Virginia's coronavirus task force coordinator said, quote, "We believe we have a vaccine in our hands today, and it's called masks and physical distancing. Each of us needs to take those steps now to protect ourselves and others so we can control this virus once again. Returning to normal sometime next year, hopefully, requires us to survive the holidays this year. And next week and the coming weeks will be a crucial test for all of us. Reconnecting with family and friends around a shared table to express gratitude for the gifts we've been giving, well, that's at the heart of Thanksgiving, of course. But it's also one of the riskiest things we can do right now for our health and the health and safety of loved ones, friends, families, our communities. Look, I've got 3 brothers, a sister, 5 daughters, 5 grandchildren, all of whom I would love to get together with over the holidays, and dear friends whom I look forward to seeing. But I don't want COVID-19 to be the uninvited guest at our table in our home. For the upcoming holiday, some of my family will be hunting, some will be hiking, some might even be skiing. Some will be taking part in small, safely distanced get-togethers, some outdoors, inviting others sometimes to join virtually. It won't be the same as getting together in person, but it will allow us each to see each other while making sure we're all safe, and that's what's most important right now. So as you make your own plans for Thanksgiving, please consider whether any in-person gathering is at all necessary, not just fun and comforting and traditional, but whether it's necessary in this time, this year. And if you think it is absolutely necessary, how can you make it safer? By wearing face coverings, washing hands frequently, watching your distance, being outside, ventilating in indoor spaces. Even outside of the holiday though, many people need to ask themselves, do I have to take this trip? If the answer is honestly no, don't do it. Don't take the risk. It's easy to think, I'll just go to the store and pick something up, one more thing. And I'll just go to my favorite restaurant and hang out with friends for one evening. I mean, it's Saturday, right? But this virus doesn't take Saturdays off, and it doesn't take autumn and winter off, and it won't take Thanksgiving off. Think every time you want to do something, go somewhere that you're used to doing and going to. Do I really have to go out right now? Do I really have to go there? Do I really need to buy that one item at the grocery store or the drugstore or the hardware store right now? Or can I make a list for later on in the week or order things to be picked up curbside? Order something to be delivered perhaps. Just because a store is open for business, and they are, doesn't mean you have to go there in person. When you take a chance, like going to a store, wearing masks, keeping distance, even going out in public in general, when you take a chance, you're taking a chance with someone else's life, with someone else's well-being, with someone else's liberty, not just your own. Think about the home health care aide. Think about the emergency room nurse. Think about the ed tech, the teacher, the school bus driver, whose health and well-being are at stake every time any of us takes a chance. To the skeptics who may hear this message, not want to hear this message, I want you to know that refusing to follow public health guidance doesn't hurt me personally. You're not going to offend me, but it hurts the small business owner who's poured their life savings into their dream and whose dream is barely hanging on. It hurts the nurse who's at a breaking point after caring for seriously ill patients for hours, days, weeks, and months on end. It hurts the elementary school kid who doesn't have internet at home and is struggling to learn. It hurts the grandparents in nursing homes who are dying to hug their grandchild. Think of them when you decide whether or not to wear a mask, whether to attend a large gathering, whether to hold or invite people to a gathering. When your college kid home from school says, I want to have friends over, I want to see my high school classmates, think again. Tell them no. Tell them no. Listen to the science. These measures we're talking about repeatedly, these protect you and everyone else around you. Look, our state, our country has faced hard times before. We've had shared sacrifices. We continue to have shared sacrifices. They continue to be necessary. If you love this country, if you love this state, I ask you, wear a mask. It's what true patriots do. It's what Maine people do. So bunker down, hunker in, buckle up, wash your hands, wear a mask, watch your distance. To all Maine people, again, if you want to keep our small businesses open, if you want to prevent our hospitals and healthcare staff from being overwhelmed, if you want to keep our kids in school, if you want to protect yourselves as well as people you may never even meet, wear your mask, wash your hands, watch your distance. Look, I know we're growing tired. This is not forever. There's hope at the end of the tunnel. There's a light there. But it has to be for now. These restrictions, these guidances have to be in place now in order for us to get a grip on this virus as we continue to make progress towards a vaccine. Remember, we can't have a healthy economy unless we have healthy people. So Dr. Shah, I'd be happy to turn things over to you for your briefing, your update, and then return for any questions. Thank you.
Thank you very much, Governor. Much appreciated. I'll start by providing an update on where things are and then turn things over to Commissioner Lambrew, and then we'll of course turn to our colleagues in the media for questions. I'd like to first start this afternoon's update from the epidemiological and public health perspective on a series of sad and somber notes. The Maine CDC is saddened to report the deaths of 4 additional individuals who have passed away with COVID-19. One was a woman in her 90s from Knox County. Another was a man in his 80s from Kennebec County. Another was a woman also in her 80s from York County. And the fourth was a man in his 90s from York County. These deaths, taken together, mark a total of 170 people now who have lost their lives with COVID-19 in Maine since we first began contending with this pandemic. I'd like to take a moment to offer our deepest condolences to the friends, families, and communities of all of these individuals who have passed away with COVID-19. May the thoughts and memories of their lives be with all of you forever. Right now, across the state, there are a total of 9,519 individuals with COVID-19, an increase, as Governor Mills noted, of 156 cases from yesterday. Of those, 8,559 are confirmed cases and 960 are probable cases. As I mentioned a moment ago, quite sadly, 170 individuals have passed away with COVID-19, and 7,229 have recovered, an increase of 209 recoveries since yesterday. Cumulatively, 600 people have been in the hospital, and just in the past 30 days alone, 123 people have been hospitalized. Just as concerning is that right now in Maine, 85 people are hospitalized with COVID-19, representing an increase of 12 hospitalizations just since yesterday. Of those 85, 30 people in Maine right now are in the intensive care unit with COVID-19, 1 additional person since yesterday. 55 people are in non-intensive care unit beds, and 10 people are on ventilators, representing an increase of 2 people on ventilators just since yesterday alone. Just a few days ago, Maine marked the highest number of individuals who are hospitalized since we began working on the pandemic. And since that time, those numbers have continued to climb steadily upwards, and a very concerning trend and trajectory. Among our cases are 1,422 healthcare workers as well, an increase of 23 healthcare workers just since yesterday alone. I would once again like to take a second to thank the healthcare workers, as well as the healthcare community writ large, for their tireless efforts in continuing to care for our friends, family members, and loved ones throughout the pandemic. Turning a moment to some outbreak investigations. Just in the past day and a half, Maine CDC has opened 6 new epidemiological investigations. One is at the BMW facility in Westbrook, where we are aware of 4 total cases. We've also opened an epidemiological investigation into Bowdoin College, where we are aware of cases among 3 students and 1 staff member. Also, at the mooring on Foreside, we've opened an investigation after finding 2 cases among residents and 1 case among staff. In addition, at Berlin City Auto, where we've opened an investigation after finding 3 cases. At Huntington Common in Kennebunk, we found 4 cases among residents, as well as 4 cases among staff members. And finally, at Paris Elementary School, where we've detected 3 cases, all among students of that school. Maine CDC is continuing to work with each and every one of these facilities to provide them guidance and assistance on infection control practices, support for laboratory testing, as well as to ensure that they have the necessary supplies of personal protective equipment as needed. We will continue to keep everyone updated as we detect more outbreak situations and our investigations into them continue. One final note with respect to where we are with testing. Before I zoom in on the positivity rates and such things, I'd like to zoom out a bit. Overall, since we began testing and working on COVID-19 way back at the beginning of the year, there have now been over 774,000 PCR tests that have been reported electronically to Maine CDC since the beginning of our COVID-19 activation. But the point that I really want to make is that our laboratory here in Augusta has done more than 150,000 of those tests. To put that number in perspective, that's more tests than the entire laboratory does for anything related to microbiology over the course of an entire year. And yet they've done that, more than that, just in the past 8 months. Again, they recently surpassed that 150,000th test threshold. And I wanted to take a second both to note that, but also to take a second to thank the folks who work at the Maine CDC laboratory here in Augusta for their tireless efforts and hours. This is a job that is extremely demanding. It's a job where there is a never-ending supply of demands for more testing to be done. It's a job that requires extreme precision coupled with very long hours. One of the things that I've learned about the staff at the laboratory is that they start their day before most of us have even thought about going to work. And at the time when most of us are settling in back at home, they're still at the laboratory running results. I'd like to take a second to thank them for their efforts in helping build out our robust testing architecture across the state. Now, here's where we stand. With respect to the positivity rate, as Governor Mills mentioned, our 7-day positivity rate right now in Maine stands at 2.66%, and our testing volume stands at 644 PCR tests for every 100,000 people. With that, I would like to turn things over to Commissioner Lambrew.
Thank you, Dr. Shah. Today, Maine Department of Health and Human Services is announcing that it will provide additional financial support to nursing facilities for periodic COVID-19 testing of their staff. Through Maine Care, the department will help to reimburse nursing facilities for their costs to conduct this surveillance testing using commercial laboratories. This investment of an estimated $8 million in state and federal funds over the coming months will help protect residents and staff from the silent spread of this deadly disease. We are also announcing that all nursing facilities in Maine now have access to Connect to Care Jobs, a portal where facilities can connect with qualified job applicants. Interested job applicants are encouraged to visit connecttocarejobs.com. This portal is offered at no charge to job seekers. We expect to expand the portal to additional long-term care sites in the near future. Providing expanded support for nursing facilities during the surge in COVID-19 in Maine is critical to help the hardworking frontline workers care for themselves and for the residents of nursing homes. Additionally, the University of Maine at Machias is becoming the Maine Department of Health and Human Services' newest swab and send. It will provide free COVID-19 tests to people who think they need a test, regardless of symptoms, and without a need for a referral from a healthcare provider. Testing will be available starting Monday, November 23rd, and will continue at the Machias campus through at least the week of January 25th, 2021, when in-person instruction resumes across the University of Maine system. The campus-based testing center will have the capacity to conduct an average of 150 tests per week and will send specimens to the State Health and Environmental Testing Laboratory in Augusta. Appointments are required and may be made beginning tomorrow. Additional information on appointments will be available later today on the Keep Maine Healthy website. With that, I'll turn it back over to Dr. Shah.
Thanks, Commissioner Lambrew. There is one other thing that I wanted to mention before we turn over to our colleagues in the media. And that is one of the shifts that we've started to see epidemiologically with respect to individuals who have been exposed to somebody who has COVID-19. Let me explain. As we go into the winter months, what Governor Mills noted with respect to the surge in COVID-19 cases happening is here. But there's another byproduct of winter that's also happening at the same time as an increase in COVID-19 cases. And that's one we're used to every single year, which is that more and more people are getting the cold or the flu. Here in Maine, laboratories across the state are reporting to us increasing number of cases of rhinovirus. Rhinovirus is an everyday virus that causes what you and I know to be the common cold. Now, what started happening, and the reason I'm mentioning this today, is one of the things that we've detected just in the past few days, maybe over the past week, is that an increasing number of individuals who have been exposed to somebody who have COVID-19 are starting to develop symptoms. And when our case investigators start working with those individuals to investigate the case of someone who's been exposed to another person with COVID-19, we work with them to arrange for testing. And because the common cold is becoming more common, a lot of people who are in that category where they've been exposed to somebody and start developing symptoms are coming back not with COVID-19, but with the cold, rhinovirus. This is a function of the fact that, again, in winter months, in colder months, the cold that we all know about is more frequent. That's a change from what we were seeing in the summer, when having a respiratory disease was a bit of a rare thing. Back in the summer, if you were exposed to somebody with COVID-19 and then you started developing a cough or a fever, there was a pretty good chance that what you had was COVID-19. But now, with more and more people getting the cold or starting to get the flu, we have to figure out epidemiologically what it means when someone was exposed to somebody with COVID-19, but now might just, irrespective and independent of that, have the flu or have a cold. Why am I mentioning any of this? Well, one of the reasons is that when we investigate cases of COVID-19, we've got to make sure we are focusing our resources on those individuals who are the most likely to have COVID. Given the increased rates of things like the flu, we're trying to figure out what that means for our investigation process and what that tells us about the changing epidemiology of all viruses. We're evaluating that right now, and our team of epidemiologists is making sure we've sorted through the data and are seeing it clearly. But what this means for you directly right now is that if you've got symptoms that could be COVID-19, a cough, a fever, shortness of breath, it is more important than ever that you take advantage of one of the various testing resources that are increasingly available throughout the state. Commissioner Lambrew just mentioned one that will soon be online in Machias. Getting tested helps us figure out whether you've got COVID-19 or whether you might have something else. And as we go into the winter months with more people having a cough, having a fever, getting tested is more important than ever, because that allows us at the Maine CDC to focus our resources, our very vital public health resources, on those individuals who are confirmed to have COVID-19, as opposed to those who might just have the cold. We're evaluating this right now, and I'll have more updates on that soon. So with that, I'd like to turn things over to the media colleagues, and the first question today goes to Allison Ross.
Hi, Dr. Shah. That actually ties in perfectly with my first question. Just two questions today. The first is for Commissioner Lambrew. So we had heard reports of people unable to actually find a testing site. All appointments, they say, were booked. So I checked, and just a few hours ago from the Maine CDC website, every location, unless you wanted to go to Calais or Bangor, was booked, and I couldn't find a single appointment on that site. We've also heard reports that places like Convenient MD are actually having to turn people away because they are just overrun with people needing to get tested before the holidays. Are you looking to add even more testing sites than were just added? And also, is it too late? Because we're also hearing that the turnaround time is now 4 to 6 days.
Sure. We're always looking to expand testing capacity. We have both our swabs and send sites, our state-sponsored sites that are online. We're hoping to announce more testing opportunities by the end of the week. We also continue to have at Get COVID-19 Tested, double check that website. Some of our national sites will show where you can get a test without a provider referral that are not necessarily state-sponsored tests. There may be a charge for those sites, but there are other sites in Maine offering COVID-19 testing. We do remain at the top or second to top of the nation in terms of our testing capacity for our targeted need. So we do have more testing than not, but we appreciate the fact that, especially with Thanksgiving coming, it may be harder to find a test. Keep looking. People do cancel appointments. We will continue our effort to expand sites, and we'll hopefully have more news soon.
Great, thank you. And then my second question here is just for Governor Mills. Governor, are you considering a statewide lockdown like some other cities that we're seeing across the country?
A statewide lockdown? I'm not sure what you're describing, but no, a statewide lockdown. In other words, like going back to a stay-at-home order. We're
Right,
talking
yeah.
a lot of other things, but not a statewide lockdown as such. No.
Great, thank you.
Thank you.
Thanks, Allison. I'm going to turn over to Steve Betts next.
Hi, Dr. Shah. I just wanted to see if there's any update on the outbreak investigation at Northeast Mobile Health Services in Rockport.
At this time, no update there. It remains at 4 confirmed cases at this time.
Okay, that's it. Thank you.
Thanks, Steve. Going to go over to Isha at the BDN next.
Thank you, Dr. Shah. I have 2 questions today. So the first one is about schools. Even though schools don't seem to be super spreaders, as you said, we're seeing more school-based outbreaks due to community transmission. Are you considering recommending that schools scale back in-person learning post-Thanksgiving or perhaps post the winter holiday like colleges are doing?
Yep, Isha, I'll start and then certainly invite others to weigh in. We can't speculate as to where what things might look like after Thanksgiving or anything like that. In epidemiological terms, that's eons away. We've got to focus on the data that we've got right now in front of us. Based on what we've seen right now, although there have been increasing numbers of cases and indeed even outbreaks in schools, the outbreak is really just an investigation to determine whether there has been transmission. An outbreak is simply just a signal that we've detected at least 3 cases that appear to be linked in space or in time across different households. And that's a signal for us to start peeling back the onion to determine whether there could have or was any transmission events. Thus far, we haven't detected transmission in schools in large numbers. I want to be clear, that doesn't mean we won't or that we can't. that remains a risk. But our goal right now, it remains to be to continue to work with schools to amplify and double down on the measures that have gotten us here thus far. Mask wearing, plexiglass, distancing within the classrooms, staggered schedules. The things that we know have brought us here right now are the things that I think we need to focus on going forward.
Thank you. My second question is probably for Governor Mills. In the absence, you just said that you're not thinking of going back to the lockdown. So in the absence of a lockdown, are you considering putting back any of the restrictions like some of the other governors are doing, like reducing gathering limits or closing certain kinds of businesses?
We're discussing a lot of options. Thank you, Isha. You know, one of the differences between this season versus last spring is last spring we had federal and state unemployment benefits expanded. The legislature, before they went home, expanded unemployment benefits, and the federal government, the Congress, expanded them. Congress sent out stimulus packages over the early summer and late spring. We had some money to help small businesses and people get through a very tough period when things were kind of shut down. And the PPP program was in place to help businesses keep people on payroll. All that's gone by the boards now. That's a huge difference. And that's why we continue to say, and as a group, the Bipartisan National Governors Association continues to say, please, to the United States Senate, the current United States Senate, the current administration in Washington, pass a stimulus package now. Because if we have to take some other measures that will impact the economy, there's no safety net provided for by the US Congress and the administration. No fallback, no help for us to give state and local governments and businesses of all sorts who will undoubtedly lose market share and lose revenue and income. And people, think about the people right now whose unemployment benefits are about to run out. It's very disturbing. We know that from the economists' review of things that the people most hurt by this pandemic right now are relatively low-wage workers, mostly in the service industry, who became unemployed, became furloughed and then unemployed, whose extended unemployment benefits are about to run out and there's no safety net for them. So Congress needs to act. This isn't about me or any other individual governor taking the measures that are appropriate for your state, for that state, to protect the public health and safety and lives of the people. It's about Congress and the administration becoming a partner and helping us get through this pandemic.
So just to clarify, in the absence of a federal safety net, you can't put into place some restrictions that might actually help with the virus surge, contain the virus?
That's not what I said. I mean, I was originally asked about shutdowns or lockdowns, so to speak, which I don't think we ever called it. But we could do the things we did back in the spring because we had help from the federal government in good part. Not just because we had to do it, but because we also had help from the federal government. That help is not there right now. So it would be even tougher to take those kinds of dramatic measures. Short of that, we are talking about a number of measured approaches to somehow reducing the gatherings that ordinarily are inevitable over the holidays. We're talking to stores, retailers, and business people and restaurants and all kinds of folks where one would ordinarily see gatherings in the coming weeks and asking them for their advice and input. And we know that there will be college students coming home from college. There will be an inevitable instinct to get together with your high school friends and with other people. And we don't want that to happen. We don't want it to happen. So we're asking for the help and advice of Maine people and businesses who may be affected by any further restrictions to just do our part, everybody do their part in keeping each other safe and healthy and alive.
I'm going to turn it over to Bob Evans at News Center.
Good afternoon. Dr. Shah, you had mentioned healthcare workers earlier. There's been talk about hospital beds and our preparedness for a surge in patients that require them. But you also talked about staff that is required for good medical care. How are we addressing potential shortages with medical staff, whether it's an increase in patients or if the healthcare workers themselves get sick?
I might
Go ahead,
begin to
Commissioner.
answer. Yep, I'll begin to answer that because we have been in regular contact with our hospitals since the spring about how do we prepare for a surge. We feel as though we have, at this moment, again, everything could change, sufficient beds, ICU beds, ventilators. We are very focused on this issue of staff. And one of the lessons we've learned is that, going back to an earlier question, one of the best ways we can prepare our hospitals and support our hospitals is to keep it safe for kids to be in childcare and kids to be in school. Because in the spring, when both were limited in terms of in-person learning and childcare settings, it was a lot harder for hospitals to get their staff in the hospitals to care for people. So as the governor said, we're trying to be very targeted and focused on what we're doing. And one of the best things we can do to make sure that our hospitals and healthcare facilities are prepared to deal for a surge in inpatient care and intense care is to do what it takes to keep our child care and our schools open.
Okay. And Dr. Shah, you mentioned the lab also. We were told today that the CDC lab is overwhelmed with tests and is now taking 3 to 5 days to get results. One, is that true? And if so, how useful is testing if it does take that long?
Sure, Bob. I'm glad you raised that. We've actually, Commissioner Lambrew and I had a meeting with the lab this morning to go over where they are and what the turnaround time is. As of right now, the turnaround time for specimens that come into the CDC lab is, it sounds too precise, but it's 0.96 days. So it's about a day between the time a specimen comes in and the time that it's reported out. Now that's what's under our control at the Maine CDC laboratory. But there's a lot of other steps that go into somebody getting their test result back. The specimen itself has to be transported to the Maine CDC laboratory. That can add a day. That's not something, sadly, that's within our control though. It can also take time for the provider who ordered the test to report the result back out to the patient. Also something that's harder for us to get control over. What we've focused on is making sure that our operations within the laboratory are as efficient and responsive as possible. And in that regard, our turnaround time stands at approximately 1 day. Sometimes now to your other question, Bob, we are getting an increasing amount of specimens. Some days, some weeks, over 2,000 per day are coming in. So although we are able to keep up that turnaround time, it is a challenge. Our lab staff are working almost around the clock to log samples, to run samples, and to report out those results. It is most definitely a challenge. I don't know that I would say they're overwhelmed or not. That I won't characterize it that way. What I will say is that they are exceedingly busy, and I am so thankful that they are on the job.
May I ask one quick follow-up? And that is, has there been any discussion with the swab and send testing sites to shift some of those tests to some other locations just to lessen the load at your lab?
So I'll answer that question. That we did know that we continue to support swab and sends throughout the state of Maine to ensure that people in Maine can have a sample collected and tested here at our state lab. What we have done though is earlier, when we did not have the volume of cases that we have now, we did open our lab to the surveillance testing that's required of all nursing facilities for their staff. So we were testing many of those nursing facilities, regular testing at our state lab. We changed that to make sure that we could continue to process samples coming in a timely way. That's why today we announced that we're going to support them to use commercial labs so we can ensure that at our state lab we have capacity.
And Bob, I don't think I was clear or transparent enough a moment ago. So let me make sure I'm doing so here. The 1-day turnaround time that I mentioned is the time from when a specimen has been entered into our electronic system to the time that the result is reported back out. It can take, in addition to that 1 day, 4, 6, 7 hours for the specimen to go through that entry process. A process that is called in the technical lingo accessioning. So we always have strived to keep our turnaround time from the moment the sample shows up at our front door to the time it gets reported to the provider at less than 48 hours. But that 1 day does not reflect the time it may take a clerk to enter it into our system. And that can be perhaps a half a day.
Thank you.
I'm going to turn over to Evan Pop next.
Hi, Dr. Shah, thank you. So I wanted to follow up on the conversation about benefit programs. And Governor Mills, you mentioned that Congress needs to act to protect unemployment benefits, rental protections, and to help state and local governments. But I was just wondering, it's certainly possible that Congress might not come to a deal by the end of the year when many of those programs expire. And what would the state do then to protect people in terms of rental protections, unemployment benefits, and other relief measures for those most at risk of falling through the cracks?
Sorry, I'm sorry to say there isn't much each state can do. We have to have a balanced budget. We don't have a surplus to play with to hand out. We are still doing rental assistance, and I would encourage people to go online with Maine Housing or with a local CAP agency to apply for rental assistance if they still need it, or even arrearages that are due. We can still address that between now and December 30th. There are a few things we can do between now and December 30th. But we can't alone extend the already extended unemployment benefits. We can't alone increase federal programs intended to help alleviate hunger, food insecurity, housing insecurity, and et cetera, and incomes. We can't do that as a state. We've done everything we could. We've just about done everything we could with the coronavirus relief funds. That's almost at an end. So Congress really needs to act. I'm very concerned about the learnings gap and the earnings gap, students still not having access to remote learning, and the earnings gap between the lowest paid workers who are still unemployed and can't get work or can't get childcare to be able to get to work. Those are those concerns I share with you.
And then just another question for you. So Dr. Fauci this week has called for more of a national strategy to deal with COVID-19. And I know that your purview is Maine and not the country as a whole, but I'm wondering if you would support a more national unified strategy between states for combating the pandemic, and if so, what you think that kind of strategy might look like.
Oh, well, I'm not going to tell Dr. Fauci what the national strategy should be, but there should be one. There hasn't been one. I'm on the White House calls. I was on one again the other day with the vice president. They keep talking about whole of America, but it's not whole of America. It's you're on your own, basically. And that's happened so many times in the last 8 months. It's unbelievable. It's appalling that there is not a national strategy to deal with COVID-19. It's kind of piecemeal. And we can't just count on one or more vaccines being made available within the next maybe 6 months, maybe 2 months, we don't know. We can't hold our breath till then. The national government needs to have a unified message about how to deal with COVID-19. And that has to include, as the national CDC has said, they've said, masking and keeping distances and taking hygiene precautions and those kinds of things. But there isn't a national strategy for therapeutics, for testing. It's been pretty piecemeal, those kinds of things. Look, our contract with IDEX was a game changer in the state of Maine. It was huge for the state of Maine. And I want to thank Jeanne Lambrew and Dr. Shah and others for implementing that back in May. I don't know where we would be today if we hadn't done that. We couldn't have relied on the federal government. to do what the IDEX contract did for the people of the state of Maine. Just one example of where the national policy has been lacking.
Thank you.
I'm going to turn it over to Taylor at WGME.
Hi, thank you. Two questions today. The first one probably would be best for either you, Dr. Shah, or for Commissioner Lambrew, but related to wait times that we were having that conversation earlier. We also were hearing from different sites that different locations are seeing a week to 2 weeks for that long wait. In your guys' opinion, do you think this is an issue due to resources or space? And just what exactly can the state do to address some of these wait times?
Sorry, Taylor, I want to just, could you clarify, you're hearing this from swab and send sites?
We're hearing this from testing sites such as the one at the Jetport, as well as the Westbrook EMS, where they say at least 5 days at the Jetport. You can't sign up for one for 2 weeks. The next available date is 11/28. So just those types of sites where you can try and get those free tests.
Sure, we are in regular communication with the state-supported sites, and we also know that many of the other sites are seeing an increase in demand. Part of it is the Thanksgiving holiday. Part of it is the end of the fall semester for a lot of higher education facility or higher education colleges and universities. Many times people are testing not just when they leave where they're going to college or university or community college, but where they go to. So we do appreciate that there has been an increase in demand. We just urge people to go to that site, gettestedcovid19.org, to look at options. Oftentimes, when you look at one moment, it may look booked, but people do change and cancel. We also continue to urge these sites to expand their capacity to deal with demand. But do shop around. You can, when you look, find sites that in different places that will have those openings. And we, from our end, will continue to look to see what we can do to expand access to make sure there's not that kind of long lead time for appointments.
Thank you. And the next question is probably for Dr. Shah or even for Governor Mills, but is Maine planning to train any firefighters, EMS, paramedics to become certified COVID-19 vaccinators, of course, once vaccines actually start?
Yes. I can elaborate, but the bottom line answer is yes. They are part of the force or the team of individuals that we are hoping to work with and tap into for their clinical expertise, as well as their relationship and linkages with the communities in which they live and serve, to be trusted sources of information as well as vaccination.
Thank you so much.
Mm-hmm. I'm going to turn it over to Patty White next.
Thanks, Dr. Shah. Several states use phone apps that alert people when they've been exposed to the coronavirus. Is that something that you're exploring? Do you see it as something that could help control the spread of the virus in Maine?
Yep, Patty, I have been in part of those conversations for months now, and we've been actively keeping tabs on how that technology has evolved, and we've been studying it, we've been analyzing it. Some of the states that have adopted it have a different population composition, as does Maine, places where you are more likely to just interact with and spend time next to a stranger for prolonged periods of time. Dense urban areas like Massachusetts, Washington, D.C., Los Angeles. That's not so much the case in Maine. For the cell phone data that we've looked at, that is publicly available cell phone data, that is not collected by us, but by the cell phone companies, just to be sure. It suggests that most folks in Maine tend to be around the same clusters of folks that they likely know. That being said, exposure notification, as it's called, is another interesting option out there as we're thinking about different tools. We haven't made a final decision. We're very well aware of the technology, but I think we've also got to keep in mind how the places that have adopted it may differ in material respects from Maine. And in light of that, whether exposure notification is the first thing we should tackle this week, or whether it's something that may not have the same utility as some of the other things we've been talking about. That's really the discussion right now.
Okay, great. And then I've got a question about nursing homes. How are they doing compared to the early stages of the pandemic? I know that they're still an area of concern and always will be, but is COVID being controlled a little bit better in those settings?
You know, Patty, it's difficult to characterize it we can try to get numbers, which I think sort of tell the story perhaps with more granular detail. We've been working very closely and continue to with our counterparts at licensure and certification as well as at ODES to make sure that nursing homes have what they need. I think what's happened is that as the prevalence of COVID-19 has increased, the likelihood that it could be introduced into a nursing home has gone up commensurately. But what's also changed from earlier in the pandemic is a much finer awareness of infection control practices, the need for assiduous face coverings within facilities, things of that nature. So they've both increased in concert. Compliance and face coverings and the availability of PPE and the understanding of infection control practices are quite high right now, but the virus is also just more prevalent now. And so what we're seeing is the confluence of both of those things. Commissioner, I'm eager to get your thoughts on this too.
Yeah, and so since the spring, we implemented emergency rules for nursing facilities. We have implemented proposed rules for infection control for group homes. We have, thanks to the governor, invested $1 million in consultation to have specialists in infection control teach people in these sites that often don't have medical directors in some of these smaller group homes how to do it. So we have had an all-out effort to ensure that nursing facilities as well as other congregate living facilities had the tools they need. Again, when there's community spread, nursing facilities and group homes are not immune. But I think in one of the oldest states in the nation, the fact that we have the third lowest nursing facility per capita infection rate for COVID-19 is a testament to the hard work that our nursing facilities, our CNAs, our frontline workers have made, as well as our teams here at the department in supporting those nursing facilities.
Thank you.
I'm going to turn it over to Brian Sullivan at WABI.
Thank you, Dr. Shah. I have a question about how the Maine CDC finds out about cases or outbreaks, and more specifically, is it the responsibility of public entities like a school or a business or a nonprofit to report it to the Maine CDC that there are cases at their location, or is it something that you find out more organically through contact tracing?
We find out about these situations in every which different way. Let me start by just kind of making a perhaps abstract but important point, Brian. Outbreaks are not things. They are not abstract ideas. They are people. They are clusters of people who are connected in some manner that all happen to have the same disease, in this case, COVID-19. And so the way we find out about these situations is manifold. In some cases, it may be that an institution or an educational facility itself has been alerted by 3 individuals within their 4 walls that they've all got COVID-19, in which case they notify us. In other instances, our case investigators who meet on a frequent basis to compare notes may say, yeah, I've got 2 cases there, and so do I, and so do I. And that sometimes can be how we piece it together. So it happens in different ways. There's not a singular pathway. But with respect to schools, we have a very good relationship with the Department of Education, who has a dedicated school liaison who themselves is involved with schools to learn about what's going on. So that way there's not this need to scramble to call the right person at the Maine CDC. Schools know that they can alert DOE and that there's a good and open line of communication between Maine CDC and the Department of Education.
Well, maybe it's a question for Commissioner Lambrew then, I guess. Is it a requirement for non-schools to report if they do have coronavirus or more than 3 cases?
It is a requirement for a lab or a provider who gets a positive test. And we actually require negative tests to be reported as well when possible. So the obligation under kind of longstanding public health law is on the provider of the test. We do encourage employers, encourage schools, encourage all different actors when they have some pattern of workers or people in their settings to report it, but the obligation is on the provider of the test.
Okay, and just for anybody who wants to chime in, we're 2 weeks removed from the increased restrictions. Is there any sign that perhaps things are going in a positive direction since, the day after election day, we'd like to report these things in 2-week cycles. Any positive signs?
Brian, it's difficult to talk about positive signs on a day when 4 people have died, to be completely candid with you. There are, the positivity rate has showed a little bit of evidence of not increasing as quickly as it was a week ago. It's still increasing. It may have paused for a day, but the overall trend is still upward. Testing volume continues to be at a good plateau, a high plateau. That's a good thing. But to be completely straight with you, on a day when a record number of people are in the hospital, a record number of people are in the ICU, and 4 people have died, it's a tough day.
So when you struggle to find something good to say, what does that tell you, that we are 2 weeks removed from increased restrictions?
I don't really know that we can say one way or the other. There are so many factors at play right now. I don't know that I could draw a straight line between November 4th and November 18th with any scientific validity or integrity.
Okay, thank you.
Mm-hmm.
Let me just chime in to say that our numbers aren't nearly as bad as certain states that didn't impose restrictions. Not nearly as bad, for instance, as South Dakota. And you see other states taking some of the same measures. You read in the Washington Post this morning, Republican governors like DeWine, Herbert of Utah, Burgum of North Dakota, Reynolds of Iowa, Baker, of course, of Massachusetts, and Jim Justice in West Virginia. They're all taking a lot of measures that some of which we took months ago because their numbers are off the charts, even worse than ours.
I'm going to turn it over to Amy Brown next.
Thanks, Dr. Shah. Can you give an update on the outbreak at Maine Correctional Center in Windham? And also regarding that, a listener noticed that there was a big spike in cases in Windham and asked us to check and see if when inmates are recorded in the CDC's numbers, if they're recorded by their hometown or by the town that the jail is located in.
Sure. So right now at the Maine Correctional Center, we're aware of a total of 148 cumulative cases. But given that outbreak has been ongoing for a while, I think it's also important to note just sort of where things are with respect to the number of active cases. As of right now, there are 3 staff members who remain in isolation because their case status is active, and 31 of the residents who remain in active status. So that's where we are right now. With respect to the addresses, we'll check to see how we and DOC characterize those, Amy, and make sure we get back to you.
Thank you. And according to your website, there are 93 ICU beds currently available, given that we went from like close to 0 to 30 ICU beds being occupied in the space of 2 weeks. At what point will you start looking at having to open alternative ICU beds?
Sure. So I'll go ahead, Commissioner.
We continue to assess what additional beds we can make available, because obviously a bed in a hospital is far preferable to an alternative care site. So we are in a continual review of what our options are to try to see how we can identify additional inpatient beds before we have to go to the triggers for alternative care sites. That said, we do have some room. We have a little bit of time, but we're making use of that little bit of time to try to get ahead of this. There's no magic number, though.
Okay, thanks.
I'm going to turn it over to Joe Lawler next.
Yes, hi. This question is for Governor Mills. Considering the high, levels of exponential growth, and you were just talking about that you're considering other measures. How close are you to making a decision on these other measures? Are we talking about there might be a decision prior to Thanksgiving or after? And I'm curious what you think about. You were talking about maybe trying to curtail some parties. I know Massachusetts did a curfew on businesses after 10 p.m. I think one of the reasons is to try to prevent large maskless parties at businesses.
Well, thanks, Joe. You know, they actually imposed a curfew on people, not just business closings. Earlier business closings is something we're talking about, among many other things. Curfews is something they've adopted in several states, and I'm not sure. You know, we're looking to see what the effectiveness of that is. I'm not sure that that's the most effective use of the most effective measure. But gathering limits, capacity limits in businesses of all sorts is something that's always being taught. We're always talking about business hours, and I've been talking with business leaders to get their ideas as well. And one of the things they've expressed to me is that their ability to enforce the mask mandate is not always clear. And I want to be real clear. We will issue some better guidance, some more bright line guidance, I think. But I want them to know, and I've told them that in my view, they have every right, for instance, to exclude somebody from a public facing facility or business who refuses to wear a mask for whatever reason. Or if they come in and take their mask off, they can be excluded, denied service or excluded from the facility, and it could be, worst case scenario, charged with trespass, and a police officer can evict them. Those are their rights, and those are what they are able to do now. It's not always clear that they have that ability, but I want to make that clear. We'll be talking about that in the coming days.
Okay, thank you. And I just have a very quick follow-up question. Considering you mentioned, you know, in other states, the COVID rate is much higher than Maine. And I wonder what you think about Mainers traveling to Massachusetts or other states with, even New Hampshire now is much higher prevalence, to other states for Thanksgiving. So are you advising them not to do that?
We're giving the same advice. We have our travel advisory and our travel restrictions in terms of requiring a test and or 14-day quarantine. And you've heard today from others that many people seem to be having a problem getting tests in a timely fashion, getting results in a timely fashion. That's probably because of the upcoming, in part because of the upcoming holiday season and people wanting to travel. But if you don't really have to go there, don't go there. That's the bottom line. We know that people have a lot of legitimate reasons to be traveling, to be going back and forth to Massachusetts, for instance, to medical facilities in Boston and whatnot. And I'm not faulting them whatsoever. But if you don't absolutely have to go, don't go. That's my advice. The less travel, the less exposure to other people. If you're stopping for gas, stopping for coffee, stopping for whatever, or seeing other people, or going to visit family, it's a different bubble than what you're used to. It's a different cohort, a different group of people. And the virus doesn't care if they're your loved ones, if they're your long lost aunt or uncle. The virus just doesn't care. And you don't want to be the one to expose them, and you don't want to be exposed by them to this deadly virus.
And I just might add that a negative test is a snapshot. It is not a free pass to enjoy Thanksgiving without physical distancing, without face masking. We do urge people to remember that it is just a snapshot. A negative test could be negative one day, but because of this virus, you could be exposed or you could develop the disease later. So we do urge people, while testing is one tool, it's not the only tool to have a safe Thanksgiving.
And Joe, I'll just round it out with two quick observations. The first is we've thought about the concerns and the risks around Thanksgiving for some time, and in the recent week, we now have a little bit of data from our colleagues to the north who celebrated their Thanksgiving on October 12th. And sadly, about 2 weeks after that, they started experiencing a significant increase in cases all across Canada related to Canadian Thanksgiving celebrations. So Thanksgiving remains a concern. The other thing, before I turn it over to Patrick to round us out, just in connection with what Brian Sullivan asked a moment ago, although it is difficult to draw a straight line between the restrictions recently, there are good data that are published in the literature to suggest that the steps that were taken do have an impact. These are data that come from a study in Kansas at the county level on mask wearing, papers that the CDC published around the experience in Arizona and Delaware that suggest that lowering gathering limits have an impact, to say nothing of more recent evidence from Belgium, from Ireland, and France, which also instituted similar measures and started to see a plateauing, and at least in France, a downturn in the number of cases. Brian, it's still a bit too early to tell whether that's what's going on here or whether those measures most directly averted a worsening, but there's good and solid scientific reason that those measures were in the right direction. And to round us out for the afternoon, I'm going to turn it over to Patrick.
Okay, thank you very much. Two things. I would love to get some feedback from any or all of you about the Maine Mariners' decision to cancel their season, which I'm assuming you probably all think is prudent. And also on the subject of flu season, some states have been reporting a sort of slow season so far, and I'm curious if we have any idea of what our own looks like as of now. And also, do we have the possibility for a sort of slower than typical flu season because of masks and social distancing and staying home and other things that so many people are doing because of coronavirus?
I can start with that one real quick. Patrick, the data around influenza are on our website. We publish a report every single Tuesday and have throughout the pandemic during flu season, not in the summer, but during flu season. We haven't missed a Tuesday, not Wednesday. If you Google Maine CDC influenza, you'll see them, and they go back decades. And we publish exactly where we are every single week with respect to flu activity. Flu activity thus far has been tracking largely where it was last year, but even in a typical year, we don't start seeing an uptick in influenza for another 2 weeks or so. Whether the trends that we saw in the Southern Hemisphere with lower than expected flu rates could occur up here in the Northern Hemisphere because of masking and physical distancing, it's a great empirical and scientific question. We'll see what the data show. But certainly, even aside from the flu, just turning to the common cold, laboratories in Maine have started saying to us, we're seeing a lot of rhinovirus. That's the virus that causes the common cold. And when we think about probable cases of COVID-19, someone who is exposed and now has symptoms, we've got to answer a difficult question of whether we think that might be the flu or the cold, or whether it might be COVID. So that's where that's going. But I'd urge you to take a look at all those flu reports. We've got an epidemiologist who is doing 2 full-time jobs. One is a full-time influenza epidemiologist, and the other is as a full-time COVID epidemiologist. And this epidemiologist, she has not missed a beat. So, but just wanted to pick up that question. As to the Mariners, I'll let the others answer.
I'll begin. I am a longtime Maine Mariners fan, so like many fans, I was disappointed to hear the news. It was not something that the state was involved with, but also disappointed that the Beach to Beacon run got canceled this summer and the fall football season got canceled for colleges and high schools in Maine. We recognize that it is very hard when some of the activities that many of us enjoy have to be suspended due to COVID-19. All that said, the work that we're doing does maintain other activities like keeping schools open, like keeping our stores open, like hopefully being able to enjoy our holidays in a safe way. So we do recognize that many of these decisions come with great sadness for different people not able to enjoy some of the activities that we all love, but that is hopefully a small price to pay to soon be on a pathway towards a vaccine and towards a return to normal.
Thanks, Patrick. Governor Mills.
I'll just add to that last one. You know, I said before, each of us needs to take all these steps, and getting back to normal, whether it's going to hockey games, going to graduations, having weddings, having family dinners, having parties, neighborhood parties, going out to restaurants in groups. We've got to resist those temptations because getting back to normal is not going to happen soon. Getting back to where we were a year ago is not going to happen overnight, vaccine or no vaccine. And each of us needs to take all these steps to protect ourselves and others, and returning to normal sometime next year means that we are required to survive the holidays this year. That's the most important thing. Well, I'll miss going to hockey games too. I'll miss a lot of things. We all miss a lot of things. And it's going to be a really difficult holiday season. We're going to hunker down and buckle up. It's going to be a tough sledding for the next few months. And that was the last question, or did we have, that was it? Well,
That was it, Governor.
Well, thank you again, all of you. Those listening, I know that you're taking this very seriously, and that's why you're listening to the news briefings. And I want you to keep remembering, I'd ask you to keep remembering the 1,422 healthcare workers who've been diagnosed with COVID-19 during this pandemic. 1,422, an additional 23 just in the last 24 hours, 1 an hour almost. So, you know, and I want to give kudos to the Calais Second Baptist Church and Pastor Burden, who's recognized what's happened in his community and is taking steps and messaging appropriately, I think, to his parishioners about taking precautions. And to those who believe that they have an absolute God-given right not to wear a mask, I will quote one of my Republican colleagues, the Republican governor of Vermont, who said, "The number of people in hospitals is growing because some care more about what they want to do rather than what they need to do to help protect others. The consequences of an overwhelmed healthcare system will have a far greater impact on our economy and welfare than all the prevention and mitigation measures. The skeptics are right. They can do what they want, but please," he said, "please don't call it patriotic or pretend it's about freedom. Real patriots," he said, "serve and sacrifice for all, whether they agree with them or not. Patriots stand up and fight when our nation's health and security is threatened. And right now, our country and our way of life are being attacked by this virus, not by the protections we put in place." I'll just leave with that message. Thank you very much.
Thank you very much, everyone. Have a good afternoon.